Hi, everyone. Welcome back. Excited to share with you today a number of recent studies and high quality studies that inform how we can use probiotics to successfully treat depression, cognition, even help with brain development of children, reduce inflammation, and improve autoimmunity. So let's jump in. Welcome to Dr. Ruscio Radio, providing practical, science-based insights into health. We break through the bias and the noise to bring you simple, trustworthy information that matters. Two pieces of context as we get started. We discussed this on the show in the past, but I think it's worth occasionally revisiting, which is the pyramid of medical or scientific evidence quality. Meaning, how do we ascertain what study is a good study, what study may not be that great? And this is from Cochrane, which is one of the most highly recognized and credible medical information databases, if you will. The bottom of the pyramid, the lowest quality evidence, is expert opinion. And toward the bottom of the pyramid, we also see things like Petri dish studies and animal studies. And toward the top of the pyramid, we see randomized control trials. This is part of what we'll be sharing today. And at the pinnacle of the pyramid, the very highest quality of evidence, are summaries of multiple clinical trials. So you get an aggregation of what the body of science is demonstrating. And these are called meta-analyses and or systematic reviews. And today we'll be covering solely randomized control trials or meta-analyses and systematic reviews regarding probiotics and how they improve things like depression, cognition, inflammation, and autoimmunity. And why this matters is this is going to give you the highest assurance that if you were to run a mini randomized control trial in yourself by trying a probiotic, what these studies find are most likely to be your experience because they've reduced things like bias and placebo effect. And they also give us, again, what's happening across multiple studies, therefore a better assurance that you'll have a similar experience. As we go from study to study, I will close out our conversation with this meta or all-purpose probiotic protocol, which is simply a distillation of all these studies down into taking the average of what formula to use, what dose, and for how long. By the way, if this has been helpful, please comment and subscribe. So let's kick off with depression. We've discussed a number of instances or on a number of episodes in the past that probiotics have a growing body of evidence showing they can improve mood, including depression. There are a few theories in terms of what causes depression. You may have heard of the inflammatory hypothesis. And within the inflammatory hypothesis of depression, which may also hold for anxiety and cognitive impairment, brain fog, poor memory, you have inflammation in the brain. This could be from microglial cells, astrocytes, and it could also be that inflammation changes the way you metabolize proteins that are needed to then make things like serotonin and dopamine. And this sort of transitions into another hypothesis of depression, which is the serotonin hypothesis. Now, we have also covered on the show in the past a pretty similar paper from, I believe it was mid-2023, that did not find depressed people had different levels of serotonin than their healthy counterparts. And so this is a pretty seminal paper, again, in the sense that it questioned the serotonin hypothesis. However, as we've also discussed in the past, this does not mean that things that modulate serotonin, so one example would be St. John's wort as a natural agent or SSRIs as a pharmaceutical agent, it doesn't mean that those natural agents or drugs don't help with depression. It's just that the people who respond to them may have normal baseline levels of serotonin. So without going too far afield into that argument, just to tie in that context. And then probably the third, in my view, most relevant potential underlying cause driving depression would be imbalances in your limbic system. The limbic system is comprised of the thalamus, hypothalamus, hippocampus, and the amygdala. And we need and want to have proper limbic system function because it does two things amongst others. One, it identifies threats and Of course, there are threats in the world, so we want to be cognizant of those threats. But if there is a overactivation of this center in the brain, it can lead to depression, anxiety, fear, worry, and may also impair things like memory and perhaps even sleep. And we've also discussed in previous episodes of the podcast how we do see increased activation of this center in the brain upon functional MRI scans in those with things like depression and poor memory, but not limited to those. There is sort of the context that we can now examine the probiotic interventional literature and how it may help with depression. So the first study is a review summarizing 14 randomized control trials in adults with depression. They were given either control, and this will mitigate the placebo, or a probiotic. Now, remembering that this paper summarized 14 different randomized controlled trials, when you look at the formulas, the probiotic formulas, used in the various studies, you see some include lactobacillus, some include blends of lactobacillus and bifidobacterium, some use soil-based probiotics. So the formulas vary, and the dosages used vary from 3 billion CFU per day all the way up to 900 billion CFU per day, which is a large or high dose. The most common dosages used were between 3 billion and 20 billion, and they did find that probiotics consistently had an antidepressive effect, which is great news, and it adds on to this growing body of research showing us that via the gut, we can have a positive influence on the brain. Now, this next study I found equally exciting because they demonstrated not only improvements in depression, but simultaneously a lowering of inflammation. And across the various clinical trials summarized, there was just under 800 patients, again, given placebo or a probiotic. And we also see here a variance from Bacillus species, specifically Bacillus subtilis, which would be a soil-based species, Lactobacillus or Bifidobacterium, oftentimes in a multi-species blend. What they found was that probiotics improved depression and an inflammatory cytokine known as interleukin 6. What I take away from these two studies is that there is a growing body of evidence showing that probiotics can improve depression. And separate to that, the improvements in depression from probiotics does not seem to be contingent upon one specific formula or one specific dose, but rather we can have these broad guidelines for here are some general rules for using probiotics, and you don't have to worry that if you don't have the perfect formula or the perfect dose, you've done something wrong, so to speak. And again, this should hopefully make the use of probiotics much easier, and I'll close with a protocol. Given we see these improvements in brain inflammation, or just inflammation systemically, which probably is also occurring in the brain, and we're seeing improvements in depression, it would also seem logical that we would see improvements in cognitive function. And so this enters a randomized control trial looking at 80 individuals with mild cognitive decline. And they were given either placebo or a probiotic-prebiotic combination. In this case, Bifidobacterium animalis at 10 billion CFU per day, along with 2 grams of inulin, a prebiotic. And that they found that there was improvements in cognitive function and attention in those given the probiotic-prebiotic combination as compared to the placebo. So not counterintuitive given everything that we've covered thus far. And to follow up on this, we just covered a single randomized control trial, but what if we wanted to get a purview of what many different studies are finding if we give people probiotics and monitor their cognitive function? So this enters a 2023 meta-analysis of 10 randomized control trials. Again, either people were given placebo or a probiotic. Given its 10 different trials, we're seeing different formulas. Mainly lactobacillus and bifidobacterium were used across these 10 different trials, and the dosages ranged from 2 up to 40 billion CFU per day. And the findings are nicely exemplified by this quote: probiotic supplementation had a highly significant effect on cognitive function in people with cognitive impairment or Alzheimer's disease. they found that the most effective usage was a dose above 1 billion, which is totally reasonable, and a duration of longer than 3 months. And it's this point I think we should cue in on. This is dissonant with what we see in many other realms, let's say IBS, digestive symptoms. Usually the impacts are seen within a month or so, but perhaps due to the fact that, and I'm speculating here, but it's based upon what we've covered thus far, if the probiotics modulate what's happening in the gut, this takes time. And as that happens, there can be a reduction in inflammation, and that has a trickle over effect to the brain. It would make sense that you'll see impacts locally in the gut first, and then spillover benefits in the brain may take longer to manifest. And while we're here on the topic of brain health, this study for parents I think is very relevant. They found that probiotics improved brain development in preterm infants. So 223 preterm infants were given either no treatment or a blend of lactobacillus and bifidobacterium at a dose of 6 billion CFU per day. So just flagging for you, this is a similar dosage that we've seen in many of the adult studies. So it's not a small dose. And that's interesting given the fact that this is in a population of preterm infants. They found after giving probiotics for only 5 weeks and then following up 2 years later, there was a 70% reduction in the risk of neurodevelopmental issues. So I find this extremely compelling, and some of why this happened is commented in this paper. Just give you a few of the high points in terms of what these researchers were thinking sort of in their discussion section of the paper could account for these improvements. Well, firstly, again, that they postulate that there does seem to be dysbiosis in preterm infants. So a disruption in the bacterial colony. Eubiosis would be balanced bacteria. Overgrowth would be too much bacteria, and dysbiosis would be imbalances in the ratio of the community of bacteria. And this can lead to lower brain-derived neurotrophic factor, which literally helps with growth of the brain, as the name implies. And also in this syndrome, if you will, there can be increased leaky gut and leakage of lipopolysaccharide, which triggers inflammation. And therefore, again, as they're discussing in their paper, the probiotics may help increase brain-derived neurotrophic factor, which we've discussed before. This helps spur proper brain development. And additionally, if you reduce the leaky gut and the leakage of the LPS particles through the gut, you reduce neurological inflammation, which also helps with proper brain development. So something to keep in mind if you have a kiddo. I have become an increasingly strong advocate of using probiotics in kids because of data just like this. Something that is not great for your brain is alcohol. Certainly, I'm not going to make the argument that you have to totally abstain. However, in some people, they overconsume. And this next clinical trial was in 46 people who had alcohol use disorder. They were treated with either placebo and counseling, so sugar pill plus counseling, or counseling plus a probiotic. And they followed up at 6 months to see what the results were. How effective may the probiotic have been in reducing alcohol overconsumption. And I'll just quote the researchers here. 6 months of probiotic treatment reduced heavy drinking levels to social or abstinence levels. So again, pretty remarkable. All of the things that we're seeing probiotics do, in this case with addiction, as documented by a randomized controlled trial. Really important to mention that because I very, very much so want to make sure we don't fall into any sort of heresy or bandwagon jumping. And this is why I try to moor us to using only the best science, because it'll give us the highest assurances that we're not speculating. And I'm not bringing to you my pre-existing confirmation bias and searching for data that reaffirms that. But this is rather, we're just keeping an eye on what's being published and picking out the highest quality studies and sharing those with you. We've discussed already that probiotics may reduce inflammation. If there are imbalances in the gut, this may co-occur with leakage. And on the other side, the immune system is called to respond to that. So we know that in these gut syndromes like IBS, IBD, leaky gut, there can be, not guaranteed to be, but there can be increased inflammation. And that's what was interesting about this 2023 umbrella meta-analysis, which will be a touch more comprehensive than just your standard meta-analysis, as good as those are anyway, summarizing 39 randomized control trials, administering, as you can imagine, across 39 trials, different probiotics. There was blends of lactobacillus and bifidobacterium. There was the healthy fungus we've discussed before, Saccharomyces. There was also a soil-based formula or formulas using bacillus. The dosages ranged from 2 billion CFU per day to 100 billion CFU per day. They found that probiotics improved multiple inflammatory markers, including C-reactive protein, TNF-alpha, and interleukin-6. Additionally, they found the most effective protocol. And by the way, it's exciting to start seeing these papers hone in on what the most effective protocols are when they examine the protocols used, as in this case, in 39 different randomized control trials. Most effective dose, 10 to 100 billion CFU per day. Most effective duration, longer than 2 to 3 months. And just to echo, as we lower inflammation, it's not surprising to see improvements in things like maybe pain or autoimmunity. But I care most about outcomes. It's interesting to see, as we just covered, reductions in CRP, reductions in TNF, reductions in IL-6. But if you had those changes on your labs and you still had joint pain or depression, you probably wouldn't be thrilled. So interesting what happens mechanistically. Most important, what happens regarding the clinical endpoints. I'm less depressed, I'm less fatigued, I have less bloating, I have less diarrhea, etc. This next study, I think, was also relevant, looking at autoimmunity. Quick primer here. Autoimmunity may originate in the gut because of the high density of immune cells in your small intestine. About 70% of your immune system is located in your small intestine. And if there's leakage, this triggers the immune system, and this can be an initiating factor for autoimmunity. I want to be really careful to say, we should be cautious not to paint the scenario that all autoimmunity starts in the gut. And as much of a gut health enthusiast I am, it's still important to clarify gut health and your gut will not be culpable for all autoimmunity. With that, let's go into the clinical trial here. 40 patients with multiple sclerosis were given either probiotic or placebo. The probiotic was Saccharomyces boulardii, this healthy fungus we've discussed before, 5 billion CFU per day. What do they find? Reductions in C-reactive protein, more importantly, in my view, reductions in pain and improvements in fatigue. This is a good transition to a meta-analysis because we just covered one randomized control trial. What about looking at a meta-analysis, again, trying to get a broader view on the body of data regarding probiotics and their potential ability to improve joint pain and inflammation? This meta-analysis summarized 11 randomized control trials. People were given either a placebo, a prebiotic, or a blend of prebiotic and probiotic. And again, they're using different types of probiotics, whether it be our traditional lactobacillus and bifidobacterium type, or maybe even a soil-based probiotic, including Bacillus coagulans species. Coming to their findings, they found that either probiotics or a combination of probiotics and prebiotics all improved rheumatoid arthritis symptom severity and inflammatory markers like C-reactive protein and interleukin-1 beta. So exciting. A little bit of a tangent would be the potential ability of probiotics to improve libido. And if we think sort of big picture, and not to paint too broad of a generalization, if probiotics can reduce inflammation, they may be able to have an impact on libido. And part of this is because when there's inflammation, hormones tend to not do what you want them to do. Men may be more likely to aromatize testosterone into estrogen, and ironically, females may be more likely to turn their estrogen into testosterone. But let's look at what this study found. It was a randomized control trial, sort of small, 100 women with depression And they were treated with SSRI antidepressants or the antidepressant plus a probiotic. The probiotic was a blend of lactobacillus and bifidobacterium at a dose of 8 billion CFU per day, again, pretty standard. And they found that the group that had the addition of the probiotic had improved libido, improved sexual satisfaction, and probably not surprisingly, improved marital satisfaction at the same time. They found that there was similarity in improvements in depression across both groups. So both groups saw improved mood, but only the probiotic group saw improved libido, sexual satisfaction, and marital satisfaction. So something interesting here is happening with the co-administration of probiotics. And I'll just quote the researchers here. The results of this study show that taking probiotics for 8 weeks may improve the severity of depression disorder, sexual function, and sexual satisfaction in depressed women treated with SSRIs. So pretty compelling conclusion and certainly something to consider. And I think important just to mention, because occasionally people will wonder, well, are probiotics contraindicated with SSRIs? This study would suggest that they're not. And in fact, they're probably quite synergistic. Okay, so in summary, we've covered a number of high quality studies, either randomized control trials or meta-analyses, that demonstrate probiotics can improve depression, cognition, brain health or brain development, inflammation, addiction, autoimmunity, and libido. As I always try to be careful to say, this does not mean that probiotics are a cure-all, but certainly I think there's an impressive and important growing body of data suggesting that these are something that should be considered for, I would argue, most people if they're trying to improve their health. And this brings me to the final component here, which is the meta or sort of all-purpose summary protocol that we've been developing now for a few years. We discussed one type of probiotic used in many of the studies, a blend of lactobacillus and bifidobacterium. Does the exact species or strain matter? In my opinion, no. Again, because of all the trials that we've examined, there was a lot of variability of the specifics of the formula. A dose that seems to be a reasonable summary from all these trials, some were lower, some were higher, but between 1 and 50 billion CFU per day. And a minimum duration of 2 to 3 months. Remember, some conditions like brain health may take more than 3 months, but I think a reasonable starting point would be a trial of 2 to 3 months. We also discussed this healthy fungus, Saccharomyces, at a dose between 10 to 15 billion per day, again for 2 to 3 months. And finally, we discussed some studies that used soil-based probiotics, Bacillus coagulans being one, Bacillus clausii, I believe, was the other. There's a few different strains, at a dose between 2 and 6 billion for 2 to 3 months. And what this protocol is attempting to do is to give you one of 3 formulas to select, and then a duration to use that formula for. You could, and this is my opinion, as I always try to be careful to distinguish, use all 3 at the same time if you wanted to sort of supercharge your probiotic. That is not going to be necessary for all people. But again, my opinion here, if you try one formula and you see some results, I would be inclined to say, try a second or third formula and see if you can obtain more benefit from the synergy. And without going too far afield into that rationale, that's what I'll leave you with in terms of, we have all this research. How do we distill it down into simple recommendations, and recommendations that are not biased by a pharmaceutical house or a nutraceutical company that's trying to advocate for their specific formula, species, or strain, but rather takes a objective, big picture view and attempts to make this simple, because it does seem as a recurring theme in healthcare, overly complicated solutions do not work. And if we have the luxury of having time, research, some wisdom through clinical experience, we should be able to go through this arc where at first we know very little, then we know more. And as we can refine all that knowledge, we can come away with precise and somewhat simplified protocols so as to make this something manageable for you to try on your own. So anyway, there you have it, a number of studies. I hope they're helpful. I hope you will comment, and I'll look forward to speaking with you next time.